venous malformation over there. Then this is the aneurysm of the ulnar artery, traumatic aneurysm of the ulnar artery, which we are seeing here. This is the grayscale imaging. This is a cystic mass, but when you switch on the color, you see the aneurysmal flow over there. This is the power Doppler imaging. Then this is a child, very interesting case. This arm was absolutely fine, but this whole arm is almost more than 3 times of the size of the left arm. And when we did ultrasound, we found grossly dilated vessels involving the whole of the upper extremities, and these are the grossly dilated vessels, and this is again a big AV malformation involving the whole of the left arm. And you can see here what is the situation in this young child. This arm is absolutely fine, but when you can see, this arm is almost twice the size, right from the shoulder going down for arm, forearm, fingers, and these are the big cavernous venous malformations, dilated veins, fibulus, and this is the flow involving whole. Surgically, this is not possible to correct. These are the situation. Like this, what we can see, a big lymphangioma involving whole of the left leg. Then cystic degeneration of the muscles with fat necrosis, floating fat globules seen over there, and these are the vessels over there in this lymphangioma. This is again an aneurysm of the superficial femoral, common femoral artery, presented as a high tumor. This is the thrombus, and this is the aneurysm what we are seeing in the common femoral artery. Again, somebody tried to operate over here in this inguinal region, they could not remove it, and this is again a big AVM you can see here. Then the child who was born with this type of the swelling over the right knee, this is the patella, and these are the vessels, again a localized AVM. So what I mean to say, that this is a lymphangioma of the foot, dorsum of the foot, crisscross band over there. So the point is this, these are the situations where high resolution sonography and color flow imaging play an important role in many difficult clinical situations where diagnostic dilemma prevails over the clinical examination. In such tricky situations, high resolution sonography with color flow imaging it provides important diagnostic criteria, and color flow imaging improves the diagnostic accuracy. So this is my center's name, and I again thank Dr. Gilani and his team for this excellent opportunity for us to share our views on this platform. Thank you.
Thank you, Professor Dr. Srivastav, for your such an excellent presentation of role of Doppler in unusual situations. Our next speaker is Dr. Syed Amir Gilani, and he is going to talk on few new ideas. Dr. Amir Gilani is the organizer of this international conference. He is the director of Gilani Ultrasound Research and Educational Institute, which is affiliated with Jefferson Research and Educational Institute, Philadelphia, USA, for 20 Asian countries and 2 provinces of Pakistan. He is the founder president of Musculoskeletal Ultrasound Society of Pakistan and is the senior member of the American Institute of Ultrasound in Madison, USA. He is the president of Afro-Asian Association of Ultrasound and vice president of the Afro-Asian Association of Radiology. He is the president of the Fetal Care and Research Foundation of Pakistan and is member of the advisory board for International Certification and Accreditation Foundation Examination, ICEF USA. Dr. Gilani is requested to present his lecture on few new ideas.
Bismillahirrahmanirrahim. Let's have few new ideas. So going to the details, I am thankful to Dr. Nasir Hamid, Dr. Durre Sabi, Dr. Mazhar Mushtaq and Dr. Nazia Fazal for preparation of these new ideas. The first thing is IUGR index. Scores are assigned to maternal and fetal parameters. There is a study according to which if abdominal circumference is less than 2 standard deviations, the score is 0. If it is less than 1 standard deviation, the score is 1. And if it is about 1 standard deviation, the score is 2. If the head circumference to abdominal circumference ratio is more than 2 standard deviations, the score is 0. If it is less than 2 standard deviations, the score is 1. Then we measure amniotic fluid index. If it is more than 15, the score is 1. Amniotic fluid index 10 to 15, score is 0.5. And amniotic fluid index, when it is less than 10, the score is 0. If there is maternal hypertension, normotensive score is 2, and if it is just hypertension, then the score is 0. Maternal weight gain, if it is less than 2 standard deviations for gestational age, score is 0, otherwise score is 1. It is summated, the summated score, if it is less than 3.5, we will say that the patient is having IUGR. Summated score of more than 4, no IUGR, and summated score of 3.5 to 4, possible IUGR. But we must have local data for the population, and the breaking news for this conference is that we have Pakistani data available from today for normal values for Pakistani fetuses. There was no data recorded in Pakistan before this study. A 3-year study was conducted from 15 June 2001 to 14 June 2004. Centers involved in this study were Gilani Ultrasound Research and Education Center Lahore and Hamid Gul Memorial Ultrasound Institute Peshawar. Study done on 139,458 fetuses in 3 years, 60,925, which is 43.69% from Peshawar, and 78,533, which is 56.31% from Lahore. Maternal age ranged from 18 to 43 years. Parents belong to all parts of Pakistan. Details collected about parity, family history, and addresses recorded. Whole of the computerized data and charts are available for references. Here is the 10th percentile for 4 fetal parameters, all parameters in mm. There is difference. If we will go in detail, we can see that there is difference from the international data. But if we compare it with the Indian data, there is a little bit difference in few parameters. Then we have 10th percentile for fetal parameters from 26th to 40th week. 50th percentile for the same 4 fetal parameters, BPD, head circumference, abdominal circumference, and femur length. Then we have 95th percentile for the same 4 parameters. So this study will be published in detail, inshallah, within a month. The third thing is the dental ultrasound, a new idea. We can scan different conditions of the tooth, of the teeth. We can look for different things. You can see the root, you can see the tooth. These are my teeth and my gums, in which I used TVS probe, just using antiseptics and then using gel, just to see how the tooth and its root appeared. And you can see there was a small area in which there was growth, and I have a growth inside. This is root, and here you can see the root of the teeth. Here is the tongue. The image is not very clear. The transverse of the tongue, longitudinal view of the tongue, and the root of teeth, but we saw excellent images from Professor Srivastava for the tongue. We can use TVS probe, the sector probes, or the linear probe, but if we have a finger probe, a small probe which we can use in the oral cavity, will be best. Then another idea is ultrasound assisted liposuction. How does ultrasound assisted liposuction differs from traditional liposuction? Suction assisted lipectomy, also known as fat suction or suction lipectomy, is a technique to remove unwanted fat deposits from specific areas of the body including the chin, neck and cheeks, the upper arm and above the breast, the abdomen, buttocks, hip and thighs and the knees, calves and ankles. Ultrasound assisted liposuction is a new improved way of doing body sculpting by melting fat cells and is similar to the airbrush of an artist. UL expands the use of liposuction for those patients. Ultrasound assisted lipoplasty involves the application of the ultrasonic energy to adipose tissues which effectively liquefies the fat, which in turn can be removed using a low vacuum suction. This process is similar to concept to lithotripsy, a procedure in which sound waves are used to break up kidney stones, allowing them to freely move to the urinary tract. In this same manner, ultrasound assisted liposuction can be used. What are the potential benefits of ultrasound assisted liposuction? Most effective in certain areas where fat is fibrous and difficult to remove by traditional liposuction, such as the hips, back, handles and large volume liposuction patients. Less surgeon fatigue, there will be less tissue trauma. Role of diagnostic ultrasound in liposuction. High frequencies of diagnostic ultrasound from 14 to 25 megahertz has been used for liposuction, but the results are not yet convincing. Then we come to ultrasound in wound healing, another concept. Ultrasound is a mechanical vibration delivered at a frequency above the range of human hearing. Clinical ultrasound units currently being manufactured typically deliver ultrasound at frequencies of 1 and 3 megahertz with duty cycles ranging from 20 to 100%. Duty cycles less than 100% are usually termed pulse ultrasound, while a 100% duty cycle is referred to as continuous ultrasound. How does ultrasound benefit wound healing? In inflammatory phase, ultrasound causes a degranulation of the mast cells, resulting in the release of histamine.